though she's our special guest today. Since it's 1:06 and some people have to get off this call for another 1:02. And are we recording? I can't actually tell.
I can
all
start
right.
recording.
Well, thank you all very much. Okay. Thank you all very much for joining us today. We have a lot of great folks here on the call, including a special guest, HHS Director Lindsey Manfrin, and she's having some technical issues right now, so we will go to her as soon as it works out for her to hear us, which is very important. But let's start off by asking Senator Roblan, what do you have to tell the group today and your constituents? Because you've been doing a lot.
So the governor is developing statewide teams. She just opened up a new healthcare one with a number of doctors from all over the state that are giving her direct information about how to move forward in particular. So that they're beginning the process of having conversations to find out how do we slowly put back into shape our economy. And that's, we aren't ready for that yet, but we have to get ready for it. And our biggest issues there are more testing and more PPE equipment. We're trying hard now to work on rural hospitals and getting them back online. And that again takes PPE, which we are ordering. The problem is the federal government swoops in and takes some of the orders on their way to the states. So we've got to figure out how to get that to happen and how we can get our PPE in line. Our state operations officers are working exceptionally well. I was on a call with the counties earlier today. Some of you may have been on that one as well. I got to hear how that process is working. Hopefully you're all getting the updates each day that show the lists and how many people are sick, how many have been tested, and so on. We did get some new PPE equipment. New testing equipment. We got, I think, something like 15 new of these new instant check deals from Abbott Laboratories. The problem is they only sent a few of the cartridges to make them work. So they sent 3 of them out. Curry County got one. 2 other Eastern Oregon counties got them. Main reason, they don't have any labs that they're associated with, so they needed to have some. And so they now have some instant checks. It takes about 15 minutes. We're hoping to get more of those. Those will be very important in the future, and we'll hope that Abbott Lab starts producing a whole lot more of those. We are in the process of having communications every day with the governor, the legislative group at 3:15. Today, we're going to hear some more about that one as well and what's happening at the state level. Earlier this week, we had a meeting, seems like months ago, so much has happened each day, but we had a meeting with the 4 leaders, the speaker, the president, the minority leaders in the House and Republicans, along with 4 members of the Joint Committee, myself, Representative Holvey, Senator Boquist, and Representative Stark, along with the majority leaders in both of the caucuses and the governor's office to talk about the information that came out from our committee was how is it moving? The governor is trying to use that as a roadmap because we were talking about things that had to be done early. She has found executive power to do most all of them. We are pushing clearly on coming up with some kind of information to counties and local governments so they can deal with their timelines. The courts have the same problem. We're working on those at the same time, trying to figure out when and if we should have a special session. The issue there is we've got all this federal money coming in 36 different streams of resources that we have to figure out. There's a breakdown of the CARE Act online and from our committee that was given out by the governor's office to all of the county people today because it was a really good explanation of what's in that act. The issue is we have to figure out what are the small print in each one of them to make sure we can use it in the right ways. We also have a statewide economic forecast coming up on May 20th, and we need to combine those because if we start paying out things and then the federal government comes in, oftentimes they won't reimburse us for money we've spent, and we would rather save our money to fill in the gaps that exist when we find out how to spend their money. So there's a lot going on and a lot of people trying to figure out how to do this appropriately and at the right time. So know that when you bring up your issues here, we will pass them on in all the mini groups that we're with, and we will try to make sure that they rise to the level. Clearly, the rural hospital issue has risen to the top of the levels of in every conversation I'm in now, so I'm pleased about that. As you know, Representative Gumberg and the Coastal Caucus worked really hard on getting the hunting seasons to not allow outside non-Oregonians to get hunting licenses, because we don't need an influx of people in the Eastern Oregon doing turkey hunting and a group of people on the Oregon coast doing clamming with these really great clamming tides that are coming up. But we do want our own local people to have an opportunity to get resources that they might use for their families. So that's kind of a brief outline of the hundreds of things that are going on all over the place and the many meetings that I get to take part of. I'm happy to be here with you guys.
Great. Thank you very much, Senator. Does anybody have questions for the Senator before we ask Director Manfrin to join us?
Casey, I just sent one to all participants in on the call, and this is for this was for Senator Roblan. So basically, I'll just repeat it.
Sure.
Senator, you know, as you mentioned, say that PPE is a concern among a lot of the rural hospitals, which I think everybody agrees with. What I'm hearing from some people in the medical field is that some of the more rural hospitals are in danger of not going forward because of a lack of revenue for elective procedures.
Yeah.
Can you address that?
Yeah, that's the big issue with PPE. As long as we don't have PPE, they don't have it to do elective surgery. And if they had extra PPE and were started to be opened up, there was a directive from the governor yesterday that gave better explanation of her asking them to close down. So if you don't need to use PPE in a office visit, a whole bunch of other kinds of things that they do, go ahead and do those. Those were never intended to be shut down. But the elective surgery issue is one that was really because there wasn't enough PPE, and we were very concerned about healthcare workers and first responders and all of those people having it, so we didn't get too many of our first responders getting sick. So they had to make decisions on how to parcel that out. And so elective surgery is clearly the problem. That's what funds almost all of our rural hospitals. And so we've got to figure out how do we get them back doing that in order to do that, or get them resources from the federal government and or the state to keep them going. Because we can't have a situation where we're in a pandemic and our hospital staff, we're laying off hospital staff across the state right now. And we need to get them back in place, ready to go. And resources for those hospitals to stay afloat, because you're right. One of the most risky ones in my district and just south were Southern Curry. They had a $2 million problem before this thing started. So we've got to figure out how to help them. We also have in Reedsport, a hospital is having a difficult time right now. And I know that Eastern Oregon, in talking to a lot of my colleagues, is having a really hard time with that. Senator Johnson also spoken about a couple up in her area. So it is a statewide problem. We've got to get out, find a solution. And some people have estimated that the solution is about $200 million. That's a big bill, even for the state, given that we are losing revenue by the moment, and we don't know what we're going to have to face when the legislature comes back in the next full session. And balancing a budget based on that, we don't want to exacerbate the already difficult situation with the economy coming back. So you're right.
Okay, thank you, Senator.
Thank you very much, Senator. And as my mother worked at North in Lincoln City, and so I know firsthand what it's like right now for hospitals that are not inundated. Yeah. And I believe, based upon my recollection, that the U.S. senators are working on including rural hospitals there's like $100 billion fund, but maybe you know more about that, Senator.
No, that's true. I think it's a little over about $1.5 billion. They are trying to figure out how to get that to the right places. There's also conversation going on right now regarding a phase 4 with respect to the federal bills. So we're going to keep pushing on the issues with respect. One of the problems in the early days of the first hospital money was you couldn't use it to supplant regular resources. Well, they don't have any regular resources, so that was the only thing we could. I mean, that's what we really needed to have was money that would come in and take care of the fact that we had to close down because of the virus, and we didn't want to spread it more in these smaller communities. So it's still a problem we have to work on.
Great. Thank you, Senator, for being very aware of that. And now what I'd like to do is go to Director Manfrin on a public health update. There's a lot of questions around testing as part of it, and kind of what it looks like to do public health as we move from public health response into, in a sense, living with coronavirus. And then what I'd like to do after you've exhausted all questions with Director is do a quick round of kind of statements to your constituents from the mayors, because we have a lot of mayors on the line today. All right, Director Manfrin of HH Health and Human Services, what would you like to tell the people of Yamhill County?
Commissioner Kulla, she's muted.
Are you able to hear me?
Beth, can you unmute her from your place?
I'm not able to hear you unless I'm on my cell phone. You can hear me?
Yes, no
Okay.
problem.
I can hear you. You can hear me, but I cannot hear you. So know that I can't hear you. So we'll have to use the chat. Get creative. So I'll speak just generally with some information that I have that I want to make sure that we're getting out there broadly. I see there's some questions in the chat box, and I'll try to tackle those. And then I'm happy to answer any additional questions that may come up. One of the big things that we are talking about right now in public health is moving away from the conversation and the phrase social distancing, and instead using the term physical distancing. That's largely just, it can seem like semantics, but I think it's really important when we are, in addition to trying to physically distance individuals, not wanting to socially isolate people. So that's the shift in that language. I'm working on it myself, so I might slip up somewhat, but I'll do my best. Right now, with the beautiful sunny weather, that's fantastic and great. It's also making some of us a little concerned that it's going to get people out and about more than we want to see them, particularly with the holiday weekend. And so we are really encouraging people to continue to follow those isolation orders, the physical distancing recommendations, and all of those things, even with the beautiful sunny weather. So that's really important. We're trying to get that message out. Overall, our projections are showing that we are making some really great progress in Oregon, and I'm really happy about that. And I think that now is the time to just keep at these things that we've been doing, because that is why we're seeing those numbers. That's why we're not seeing our hospitals overwhelmed, and we're being able to manage the situation. So just wanting to continue with that encouragement. I get a lot of questions around tests. And so I see a lot of the questions in the chat are already about testing. So I might just start with that and talk a bit about those. One of the questions it looks like is how many of the deaths were reported deaths were actually tested for COVID-19. So I can speak on the state of Oregon, and certainly within Yamhill County. Anytime that we are reporting a death related to COVID-19, someone has actually had a nasopharyngeal swab or a sputum sample, which is stuff you cough up, to be tested. So there's no, at least from that perspective, there isn't guesses, so to say. We're not making the assumption that someone may have died of COVID-19. We really are testing them, and there have been some circumstances those tests have been done after someone has passed away, to be sure. So hopefully that gets at the heart of that question. Another question is how many. What's the county doing to make local decisions to ease stay-at-home orders to lower our suicide, child abuse, and domestic violence risk population? Certainly, that is something that, as the Health and Human Services Director, we're very concerned about. I think certainly one of the things that we're trying to do is continue to connect with all of our clients. So I think it's important to recognize that none of the Health and Human Services services have stopped. Some of them look different today than they did before. Our crisis services, both in person, mobile, and over the phone 24/7 are still 100% intact. We're still going out with law enforcement. We're still engaging with our hospital partners, and all of that work continues. Our general outpatient services are being provided right now in a combination of both in-person visits for individuals that just really need that in-person connection, and then for those individuals who are able to, the vast majority of those general outpatient services are being provided via telehealth. We're continuing to connect with anyone who's been engaged in our services and follow up with them to make sure they have all of their needs met, continuing therapy services and things like that. We're in close contact with all of the other behavioral health programs within the county, and they are doing very similar things to that, meaning telehealth, doing lots of phone connections, and following up with people in that manner. And so I think that is very supportive for those individuals. We also recognize that for individuals that may be experiencing things like the abuse, whether that's child abuse or domestic violence, that their situations might be pretty dire right now when they have that happening, and then they're also being more and more isolated. So we are working, I've outreached to some of our shelters like Henderson House and things like that to see how we can best support those populations, and hoping to hear back, and we'll be able to engage in finding some meaningful solutions to make sure that those populations are supported, taken care of, and if needed, removed from any sort of situation that they're currently in, if that is something that they are ready and prepared to do at that moment in time. That could look like hoteling, it could look like a number of things, but we are prepared to support those efforts if needed. We're also putting together a warm line for non-crisis services that we're working to establish, which I hope will be helpful for those people who may not be experiencing a mental health crisis, but are still in need of supports and things like that. I know that Medicaid, our local Medicaid plan, is expanding what they are able to offer as far as transportation services, so that they're able to support people in getting groceries and other types of basic needs in an effort, again, to make sure that those things are met, and that we don't have individuals in their homes that are just completely lacking connection and support. We have not seen a local rise in accessing crisis services or deaths by suicide, but it's certainly something that we are monitoring and watching closely all the time, including right now, so that if we are to see that we can quickly figure out if there are other things that we can be doing as a community to prevent any of those tragedies from happening. Another question here is, what's the plan to get an antibody test to rule out that the majority of our county may have already been exposed? And there's a follow-up stating that it sounds like some counties who are doing this are seeing 30 to 40% have prior protection. Great question. So I'm not aware of any Oregon counties that are currently doing any antibody testing. I'm aware of one test that has not been fully approved by the FDA up until now, but I am hearing from my Oregon Health Authority partners that they anticipate that happening as early as next week. I will be on a call with them today, and I hope to learn more about that, as well as get some preliminary plans in place for how we would roll that out as a county if we were to begin doing that. I think likely my public health partners and I, when we have talked about this, and certainly when we've connected with our medical director and public health officer, Dr. Bill Koenig, the largest or the first priority really for that type of testing will be for our healthcare providers and EMS responders, wanting to find out which of those groups who are certainly at highest risk of contracting it from their patients, who may have already been exposed and have those antibodies, and will give us some sense of that. My understanding is that this is not, the antibody testing is not something that's happening really, like I said, I'm not aware of anywhere that's happening. But certainly, if other folks are hearing that, I can certainly try to find more information out about that. But I anticipate having more information by as early as next week, and then we will begin to think about how that would look in our county. Like I said, the first priority would be healthcare providers and EMS responders, and then we would go from there. I have another question. Yeah. Are there other questions people want to write into the chat? I'm sorry that I can't hear you. I could try to read your lips, I suppose.
Senator and representatives and mayors, commissioners, do you want to send notes to Director Manfrin through the chat? Or you can tell them to me right now and I can give them to her.
Hey, Casey, this is Mayor Cape, if I can. I've given up using my tablet, so I can't type. I'm using my phone. But my question is I know we have in Amity at least one confirmed test positive for COVID-19. And some of my residents have been asking, well, we know we were in contact with that person before they were quarantined. Yet they have not been contacted by the county health department and so, you know, they have big concerns of, well, were we exposed, or are we, you know, carriers of the virus now, and are we going to get sick, and all those type of questions. And so it's just kind of like, I guess the question I'd like to have answered so I can provide feedback to my residents is, you know, what is that process that the health department's going to use to contact people that were in direct contact to people who have tested positive?
That sounds great. Thank you very much, Mayor. So I've sent her the question, and I think she may be able to see it because it looks like she's reading to the right, or to the right, yes.
Okay, I'm happy. Can you hear me? Okay, so happy to respond. Talking about the contact tracing we're doing. So the contact tracing is something that's certainly not new for public health to be doing related to COVID-19. There are a list of over 100 reportable diseases that we receive at any given time that we're following up on. And so it's a very similar process that we're doing, just more of it than we're typically doing related to COVID-19. And so what that process looks like is we get information related to a positive case. All of those labs are automatically reported to public health. So anytime there's a positive lab report, it automatically comes to us, and we begin our contact investigation, sometimes called a contact tracing. That begins with a very in-depth and thorough interview with the person who is sick, and getting information about all sorts of things, symptoms, symptom onset, how long symptoms were severe, and then any contacts that they've been known that they have been in contact with. So we look at where have they been, how long were they there, how close were they to other people, what does that look like, and so we really do just ask a ton of questions that can be kind of exhausting for the poor ill individual, but it's really important for us to get that level of detail. Once we get that level of detail, we make some determinations based on that information of who would be at risk. So for an example, if they told us that they were at a park by themselves, far away from other people, that probably wouldn't be nearly as high of a priority as, say, they were sitting in an office next to someone in a cubicle and having lots of contacts. So we take all the information they give us and then get the information of the people that we need to contact and then follow up with those individuals. What those individuals do next really depends on the situation, but our goal is to notify them of the potential contact with a sick individual and then provide health guidance based on their level of risk, both them as an individual because of potential vulnerability with whether that's age or health conditions, or because their exposure was pretty high. In some cases, we may recommend testing for those individuals, but not all people. And some of that has to do with the availability of testing, which is still pretty limited, and so we may not always recommend that. There are a few places where we will step in before we even have a positive case, meaning we just get a call that someone is having symptoms, and we don't want to wait until that test results comes back. We want to step in right away. One of those would be in a long-term care facility. Another would be someone who may be in a homeless shelter or something like that, where there's that congregate housing. And we know that those situations warrant an immediate response. And so we will begin to work to mitigate control measures and things of that nature in those types of settings, just while we're waiting for those test results, because we don't want to wait. Sometimes it can take anywhere between 24 hours and 7 days to get those results back, and we certainly don't want to wait for something like 7 days in a long-term care facility where moments are critical. Yeah. So I'm just going to keep looking here. Would you like to clarify how many confirmed cases were actually tested with PCR? So all of the Yamhill County confirmed cases are done by PCR. My understanding is that's the case with all of the state numbers as well. That's the only test we have right now. So those would be, that's how we're running them. So all of those tests are PCR. The test is, like any test, it has its own challenges. This particular test, if we are doing the nasal pharyngeal swab, which is the swab that's quite unpleasant that goes in the nose, it has about a 70% efficacy rate, meaning 70% of the time that's going to be accurate, about 30% of the time it's not. That's a little higher if we get a sputum sample, that bumps it up to about 80%. Question regarding Oregon Trail cards. Oregon is increasing funding, but I'm hearing from some older rural residents who have health vulnerabilities that they still need to go into the store to use their benefits. Any ideas or alternatives? I know that there's work happening related to this. So certainly those people who are engaged in any of our health and human services, many of those people, we have staff who are supporting them by going to the grocery store for them and getting their food and bringing it to them and reconciling the financial matter later. And in some cases that we have a different funding stream for that. But I do know that they are working on doing some things related to being able to virtually use things like the Oregon Trail card. I don't have a ton of details on what that will look like, but I know that there's efforts to try to get that in place because that's a huge need.
Any other questions for Director Manfrin?
Sorry, Mary, Commissioner Starett had asked to be, yeah, there we go.
That's great. I was just going to ask you.
Thank you, Commissioner, and thank you, Beth. So, Lindsey, can you hear me? Can Lindsey hear me?
She cannot. Commissioner, do you want to try? Oh, Commissioner, if you ask your question through this, then I can send it to her as a chat.
Okay, great. Sorry for the extra step because I'm by phone, but thank you for that. And maybe just for the group, Lindsey Manfrin has been working with such grace under fire, and she has just been doing such a wonderful job, and I just wanted to give her and her team kudos. But I just wanted a couple of questions about the projected surge. And the surge is supposed to be where we have our peak cases, I guess, April 24th and 25th. But in looking at some of the data, it looks like those cases peaked before the executive order. And some of the estimates that are being used are 5 and 10 times higher than we're actually seeing. So I'm looking at the number of hospitalizations for emergency department visits, and they actually peaked around the middle of March and have declined to almost, as of 4/5, they're down to virtually nothing in terms of that. So I guess what I'm asking is the fidelity to the actual data and the projections and how that's factoring into what we're doing as far as policy. I know that's long-winded.
Okay, Commissioner, I sent her as best I could because he's not the minutes taker, but she has some of that information, and she may be able to go for it.
Okay, thanks.
All right. This is totally ridiculous, but go for it.
Okay. So looks like the question from Commissioner Starett is around, well, it says projected surge in cases April 24th, 25th, but it looked like cases peaked before executive order of stay home. Cases projection versus actual and policy changes from that. You know, I don't know that I have an answer to that specifically. I'm not aware of a peak that happened before the order was issued, which I believe was in early March. So I would have to get more information about that before I could respond. Sorry, Commissioner Starett.
And
That's okay, thank you.
I gave another update to Director Manfrin to hopefully help her. I think it's based upon the OHA and their SITSTAT report that shows that hospitalizations appear to have fallen off from a peak. I think that's what you're referring to. That's what I see from Senator Boquist.
Yes, and the emergency department visit peaked on the 8th of March. The executive order was on the 23rd, and as of 4/5, the COVID-19 visits were shrinking to almost zero.
And I'm going to communicate that to her. Sorry about this. Okay, she has my shorthand for that. Other folks on the call, while we're waiting, do you have more questions for Director Manfrin? Or after she's done, I'd love to do the round the room of mayors and what you'd like to tell your constituents. But let's give Director Manfrin a shot.
We'll take a little. This is Senator Roblan. We'll take a little shot at that. Before that, the peak in total emergency room use had to do with people having car accidents and a whole bunch of other things. Those have drastically gone down. Plus, we have not allowed the other surgeries to go on. So our what's happening in emergency rooms has really gone down. So does hospital usage. The good numbers to look at are the fact that, and I think Starett is right on that, is that our new cases have either stabled or gone down, and that's the one we're looking for as a peak. And it's the peak with regard to the peak we're looking at is the peak regarding to coronavirus, not the peak in the use of the emergency rooms. We basically emptied out all of our hospitals so that we would have room if there was this other big peak. So I think that's the two confusing deals there, because I've been watching those numbers too. And if you look at the graphs, it's pretty obvious that hospital use is going down, but it's mostly because of the inability for hospitals to do the surgeries they've been doing in the past, and the fact that people are staying at home and we're not getting as much use of emergency rooms. That's what I have seen.
Thank you, Senator. I'm looking at a graph that has non-COVID visits to the emergency department and COVID-related visits.
Oh, okay.
And the graph does show that COVID-related emergency department visits peaked on 3/15 and are down to virtually none on 4/5. So they have just differentiated those two different visits.
Yeah. Okay, very good. That was good to make. I just wanted to make sure that was clear. And one of the things we're doing is we're doing a lot better job of taking care of people outside of the emergency room with COVID, and I really appreciate that. Some great work done by the Veterans Hospital or the Veterans Home in the Lebanon area too, that kept all of their older patients out of the hospital emergency rooms, kept them in their places being taken care of. So there's been a lot of work being done to keep people out of emergency rooms and into just care. So hopefully we can keep people from getting to that advanced stage in COVID, which requires the emergency room. So I hope that's happening.
And I can just, from a McMinnville standpoint, in the hospital there, what the senator was saying is absolutely correct. We have less than a handful of people in the hospital right now, beds being used, and they're holding those. If there were a surge, they've got their PPE. They're all prepared for any uptick. But as of last week, just a handful of total patients in the hospital.
Director Manfrin, do you want to? And thank you, Senator Roblan.
Sorry, I'm having to go back and forth between a phone to try to hear where I can, but then yes, it looks like there's some question around just the stay-at-home order. Is that related to COVID? Is it not? So certainly, if it's not related to COVID-19 or coronavirus, I am unaware of anything else that is related to. Certainly, my colleagues around the state and my connections and folks that I know at the Oregon Health Authority are very concerned about COVID-19, and we're seeing things like what's happening in New York, and we are getting requests to send nursing teams to places like New York that are seeing the surge of what we have been trying to prevent in Oregon. And so if there are things happening unrelated to that, I'm certainly not aware of them. And am certainly grateful that what is happening seems to be working, and that we are not seeing the overwhelm of hospitals, and we are projecting that we will not see the overwhelm of hospitals, because I believe wholeheartedly that when this first began, that truly was the overarching concern, certainly from myself and other local public health administrators around the state that I work closely with.
Great. Thank you very much. Unless there are further questions, I'd like to move to the mayors. And thank you very much, Director Manfrin. Whoops, I gave her the thumbs up, which is the sign to talk. So we'll do this. Mayors in the room, let's begin with Mayor Potter from Yamhill. What would you like to tell folks in Yamhill right now? And welcome, Mayor.
Thank you, Commissioner. I appreciate this time and opportunity. The City of Yamhill is coordinating efforts between City Hall, Public Works, Police Department, Fire Department, and the school district to encourage our community to stay home, stay safe, but provide for the needs as they arrive. For example, our schools are providing meals, breakfast and lunch meals, to all of our children 0 through 18, and they're being delivered by school bus, and they're also available by drive-through pickup. So that's pretty exciting. Great coordination happening at the schools. We have enough PPE to meet our current needs, and we have enough available currently to handle any urgent needs that may arise. We do have some PPE on order to continue to restock our supplies. All the city offices are closed to public walk-in, but we are conducting normal business, and people are available through phone call and email to for any services that may be needed. The City of Yamhill is still conducting City Council meetings as regularly scheduled, and contact for the public is available through the city website to contact the city and be a part of those City Council meetings. And we've got information also on the website for COVID resources for our local businesses, and some information for our community to access if they don't want to have to run through all the web pages that are available out there. They can find it all in one spot. And that's about it. We're doing good, actually. The city's running very well at the moment, and it's kind of quiet, but we're doing well.
Great. Thank you very much, Mayor. I appreciate having you here and being able to speak to the people of Yamhill. Mayor Sprout, it looks like just dropped off. Sorry about that, Mayor. Mayor Cape, let's go to you, even though you already shared with us a little bit. What would you like to say to the residents of Amity?
Yeah, this last Wednesday night we had our annual or monthly council meeting, and we did excuse me, we did declare a state of emergency a little bit later than several other cities have, but we did that. And one of the main things people have asked is, kind of why they don't really see the state of emergency for the city itself and the residents. And I just wanted to reiterate mostly to them that it is primarily for financial assistance availability as what's coming out through the CARES Act, and more importantly, the fourth round of legislation from Congress and what they're discussing. And there's potential there for financial assistance to businesses, residents, and the city itself. And so that's why we primarily moved ahead with the state of emergency declaration. And other than that, we had our meeting on Wednesday. We conducted it with Zoom, and it was mostly successful. And I anticipate us holding all of our regular committee and council meetings through May and into June if necessary by using Zoom. And we had, I believe, one resident call in for our meeting with Zoom. And then we did have one resident come in person, but there certainly is enough space in our chambers to keep the I know it's not social distancing now, but the physical distancing that's necessary. So we were able to have a nice, safe meeting and accomplished all of our work. So that's really kind of where we're at. And then I also wanted to make sure Mayor Wytoski saw the good colors I was wearing today. So with that, go Beavs, and thank you.
Well, thank you very much, Mayor. I noticed them, but all right, Mayor Wytoski, what do you have to share? And I just want to do a quick, do you want to do any updates on schools and education?
I can. That's what most of my time has been spent on for sure the last 2 days. So I can start a little bit with schools. I can really only speak to what we're doing in Dayton, of course, but I assume it's looking pretty similar across the state with the changes in the latest ODE directive. A lot of our Oregon high schools have significantly higher requirements than our regular state diploma. I also am the senior class advisor, so one of my responsibilities is doing senior audits. So of course I had to run a brand new round of audits yesterday. The good thing is, of course, reducing requirements is going to make more of our students graduation eligible with a regular diploma instead of a state diploma. So that's some good thing. It's a lot of extra work right now, both kind of wading through all of the directives and making sure that we're checking for compliance on a lot of things, and then also trying to create some really good and clear and concise communications for both our students and our families. So that's actually, if you're seeing me like kind of looking at other place, I'm working on a letter to parents. I think it's, I'm really, if I can be just super honest on this call, I have a lot of concerns just about my students' safety. Kids where we have certain amounts of control over their learning environment when they are with us. And now I do feel a lot of stress for kids who I can't give them a granola bar when they come in to make sure that they're fed, and I can't take care of some referrals and things for them. That really does stress me out. But I know one thing I know, and I have several teachers in my family, so I don't think it's unique, but one thing I know is that teachers always step up and they always figure it out and they always put the kids first. And one thing I really appreciated in the ODE directive is that it does seem to err on the side of kids. And it really puts what is going to be best for kids and what's going to get them a diploma first, recognizing that if they've put in 12 years and 7 months, that being out for 2 months shouldn't delay their completion time. And I really appreciated where our thing at my schools, it's just grace. We just need to figure out how to offer grace and everywhere that we can. And I really appreciated the directive seemed to allow us to do that. So that's great. In other city stuff, I don't have a lot of new things since Tuesday. We had our telephonic virtual meeting like Mayor Cape did. on Monday, and it went pretty smoothly. We have gotten a lot of contacts from other cities at this point about the rebate program, which we call Urban. And so that's been really great to see more cities adopting that. It helps both residents and businesses. So it doesn't cost the city as much money as a direct grant program might. So for smaller cities, it's a really, really good way to help some folks out. That's been really positive. You know, my community's done pretty well. I think last night we had one neighborhood set up a social distance block party, which I didn't get to attend. I don't live in the neighborhood, so I didn't get invited, but I did see some images on social media and thought they were really, really beautiful. Each family just set up lawn chairs in front of their homes, so they were probably 15 to 30 feet apart or more. And they just kind of hollered, and they played some music, and I thought it was really lovely. There was no direct interaction except among household members. But it got kids outside, it got seniors outside, and they did have an opportunity for some interaction. A few of them, I understand, called each other and FaceTimed each other because they couldn't quite hear each other across the street and things like that. But they had that line of sight visit. And, you know, I think it's really important that we do remember. I actually love and appreciate Lindsey's comment about trying to, you know, shift to physical distancing instead of social distancing. I think it's important that we remember to reach out and try to have those social connections where we can, whether it's through Zoom conferences like this, where people are doing, you know, birthday parties and staff meetings and things in a new way, or whether or not it's FaceTiming your neighbor across the street while you both sit in your lawn chairs 40 feet apart so you can still have some interaction. So I love that message. I think that's really positive. And I'm really, really happy to see my community trying to find ways to keep those critical connections without endangering anybody.
Great. Thank you very much, Mayor. Mayor Hill, a couple, just maybe a minute or two update for the city of McMinnville and what you'd like city residents to say. To know, sorry.
Thank you, Commissioner. Just a really quick update. We had our leadership meeting on Thursday, and I can just go down a couple of things. St. Barnabas, which does our soup kitchen, is closed for 2 weeks. The cook came down ill, and they're not sure whether that individual has a COVID-19. So 3 other churches downtown are stepping up. The Cooperative, Presbyterian, and Baptist Cooperative is feeding on their day at their church or pick up meals at their church. And then the other 2 are using the parking lot of the library as a pickup spot. This morning, for those that were able to go or be on the LOC meeting, we had the regional director of the SBA on and just talked about how difficult of a time to be able to get SBA support and applications in. But we do know that some of the larger banks, U.S. Bank, Key Bank, are the ones that are kind of leading the charge in the small business arena. First Federal is not doing any of those loans because it's not an area of expertise and they're not certified. Lastly, the schools. School district has given out 3,200 Chromebooks, and all students have a way to communicate. They are moving forward with their online schooling, looking at maybe some creative ways of graduation, like through cars. Mary Alice shared those types of things. Lastly, the library is delivering books for those that would like books. Our code enforcers are delivering medicine for those that are homebound. We have a new executive for the hospital coming from Providence in Newburgh, Lori Brennan. And then lastly, we have a new owner of Evergreen. That just happened. So those are some of the things that are happening from McMinnville's standpoint.
Great, thank you very much, Mayor Hill. Before we end at 2 on the dot, there's at least 1 commissioner and 2 representatives who I'd love to hear from, and then Shannon Buckmaster from the Yamhill Chamber as well, and she may have an update. But Commissioner Olson, what would you like to tell the residents of Yamhill County in about a minute?
In about a minute? I'll go real fast. First of all, I'd like to tell the community, just like, and I think Commissioner Starett said it very well, just like any private business or other government organization, Yamhill County is doing all we can to make sure that we're providing a safe and healthy work environment for our staff. But we also have a lot of the things we have to apply with, just like private business, as far as closures, working people from home. I think as of the day before yesterday, we have 275 employees working from home that were able, and we do have our really certain employees that can't work from home that are putting up the most to do the work they have. And then the second thing I'd like to bring up really has to do a little bit about the economic growth in Yamhill County. I think we all know that our economic growth is really suffering, and a lot of that is not only COVID, but a lot of that is due to the failure of ODOT to recognize the Dundee-Newburgh bypass as a critical funding, and not funding it in the STIP for 21-24. So if anybody can, it's closed at 5 today. We really need letters of support to ODOT to actually make sure that we get that completed, to make sure the whole bypass is completed. And I think that's about it, Casey.
All right. Thank you very much, Commissioner Olson.
And I'm
Commissioners
going to drop
Stromberg
off.
and Noble, you're on. All right. Commissioner Noble, welcome back. What would you like to tell constituents?
Well, I'd love to, first of all, I want to thank Director Manfrin for this great update. Senator Roblan did a great overview of what's going on at the state level. So I don't need to repeat that. It's encouraging for me to know that we're trying to plan months in advance for an economic recovery. And I would toss that out there. But specifically for people in my district or even outside my district, we're getting a lot of calls regarding unemployment and small business administration loans. Please give us a call. We'd be glad to help negotiate that or navigate that process through with unemployment issues, or if your business and you're trying to apply for a small business administration loans. So I think I'll leave it with that, Commissioner. Thank you all, mayors, for all the work you're doing, commissioners, for all your work you're doing in your communities. It makes a difference. Really appreciate that.
Thank you very much, Representative, and thanks for being available all the time on the phone. Representative Gomberg, in the last minute, what can you tell us?
Well, how about you calling me first at our next meeting, and I promise I won't talk too long.
On that note, that sounds great. It's a deal. All right. Thank you, everybody, for joining us today. And thank you for the great questions from the audience. Stay safe and wear your mask. All right. Thank you, everybody.